Hi, I'm Leslie.
I'm Hazel.
I'm Jackie.
I'm Jessica.
And I'm Jose.
And our civics inquiry problem is the lack of attention to the mental health of the students at Loera.
Now let's take a look at what we're doing in order to achieve our goal. We began taking our actions by conducting interviews, surveys, and posting informational flyers all around campus. We focused our interviews on 3 of our very own staff members that deal with the youth on a daily basis.
Mental health. I'm here with Loera school psychologist Christine Carter. So can you start off by describing a little of like what you do daily here, like what your job is?
Sure. So I do a lot of different things. Number one is always to support students, whether that be academically or with social emotional needs. The majority of my time is spent with special education students.
I'm the health tech here at Lower High School. My name is Angelica Martinez.
So on average, how many kids come here daily to visit you?
I would say about 20 students.
And today we're interviewing Miss Dotan, Miss Wendy Dotan, and
I greet the students at the door and I give them a short lesson and then they have to work on their own, and then I walk around and I check on them and I talk to them.
We also interviewed 3 students and asked them about their experience on a daily basis at Laura.
Well, personally, I just keep to myself all the time. I don't really feel like talking to anyone.
So my name is Carla Mena and I'm a senior this year.
Alondra Lopez and I'm a junior.
The mental well-being of students is a topic that should have much more attention, considering that mental illnesses such as depression, conduct disorders, and substance abuse are some of the leading causes to suicide. According to the National Association of School Psychologists, suicide is the leading cause of death among school-aged youth. In 2015, approximately 18% of 9th to 12th graders seriously considered suicide, with 9% having made an attempt 1 or more times. Some suicide risk factors we should be looking out for are previous suicide attempts, hopelessness, non-suicidal self-injury such as cutting, and again, mental illnesses, especially severe depression, but also post-traumatic stress and ADHD. Other causes are more situational, such as bullying, harassment, and abuse. Some tips the NASP gives when dealing with peers that seem in danger for suicide include providing support and promoting healthy problem-solving skills, which includes never ignoring or keeping any information a secret. Friends should not agree to keep things a secret and instead tell an adult, whether that be a parent, teacher, or school psychologist. When having conversations, remember to remain calm, non-judgmental, and just listen. Ask directly about suicide, using phrases like, "Are you thinking about suicide?" Focus on your concern for their well-being and avoid being accusatory. Don't use phrases like, "You aren't going to do anything stupid, are you?" And make sure to reassure them that there is help and that they will not feel like this forever.
Yeah, so there's always going to be that factor where you may not want to tell, some things are just very personal, or you're in a situation where you feel like you can't tell somebody. So there's many things that you can do on your own. So a lot of students like to journal or draw, art, music. There's other outlets to deal with your stress or your anxiety. So I think that's something that is positive, or just surrounding yourself with positive influences and good friends. And until, that person's ready and willing, then there are other things you can do by yourself.
I see a lot of students who struggle with anxiety, or they have stressors at home that they don't know how to cope with. And so then they come to school and they're really not thinking about learning about similes and metaphors and personification. They will sometimes act out, or they will just not engage with the lesson, so they'll just want to put their head down. I've seen students cry. I've seen students throw things. A lots of things that, I did not imagine when I was in teacher school.
Extremely important, if not like the number one determiner in how a student's going to perform. So some students will shut down completely if they are not feeling right. It makes sense. I mean, if you have horrible personal life problems, why are you going to care about a worksheet, right?
Yeah.
That's just not the focus. Or maybe you're just trying to survive. Maybe you don't have a place to live. Maybe, the list goes on, the things that could have happened before you walked onto the campus this morning.
Definitely, because if you're feeling down mentally, you could lose motivation to do anything, to lose motivation to do your work in class, do homework, or even just talk to people.
When you
I think that we definitely need more staff that's going to be there to create more of these supports that students are now asking for.
I think that would be a good idea because the counselors are so busy with academic counseling, fixing schedules, enrolling students, and our social worker is only here twice a week. And our psychologist is usually busy with IEP and special ed students.
I think it's a tough issue because it's not just Lowera's decision. It all comes down to a funding type of thing that gets decided, well above our heads. So in short, yes, we always need more people, but I think it's really great that the students are now being more aware and more willing to talk about what their needs are. So definitely we can always use more.
So yes, more counselors, social workers would be an awesome idea.
A couple years ago, I did a big project where I did it with the county of Orange County, and they brought in this green bench. It's called the green bench, and you could sit on this bench and you could talk to people about how you feel in a non-judgmental way. And I'm trying to bring that to Loera full time.
Yeah.
And so we made a whole big plan that for this area right outside my room, which is kind of broken down.
Emotional support benches are benches that would be placed around campus to encourage students who are having a bad day to sit there and get the support they need. The difference between a normal school bench and an ESB is anyone can sit there and go about their day without being approached for their issues. With an ESB, also known as emotional support benches, you could distinctively tell that the person sitting there is having a rough day and most likely would like some help or someone to talk to.
So now we gotta just figure out how we can get the district to do it for us.
When you sit at one of these benches, it shows that you are not feeling well and want to talk or just be left alone. People can go up to you at these benches and talk to you and help you.
I feel like they could do a better job at showing that they're there and that they can help, because they don't really say it often.
Are you aware that the school has a psychologist?
No. Yeah, mostly with my AP classes.
With your AP classes? How many AP classes are you taking?
I have 2, and then I have an honors class. So it's a lot of work, and I get stressed out because of all the tests and then all the work they give us.
Yeah. Days where you wish you just couldn't be at school, kind of like a slack off day?
Those are the days I don't come to school. Sometimes I take a day for myself and I do nothing.
Because people are just afraid of being honest and just accepting their personal issues and actually getting help, because people think that I'm fine and that they're fine, but in reality they're not, and they suppress the help that they could get, and it just makes them worse.
It just depends on how other students would react to it. Because sophomores and freshmen are very childish.
Yeah.
And then there's times when they would pick on other students because of that.
Because they're sitting on there?
Yeah, so it's kind of a yes, but then again, they have to be careful because the reaction of the students.
Yeah.
I feel like it all depends on the person. But yeah, that doesn't sound like a bad idea.
How often they speak to an adult about their emotional health issues. 14% answered every month to 3 months. 6% answered every 3 months or so. 79% of students answered not at all. Then we asked about the mental health assistance that Laura provides. 2% said they were extremely satisfied. 16% said they were moderately satisfied, and 32% said they were not satisfied at all. 10% said they felt neither satisfied nor not satisfied. And 38% of students did not know we offered mental health.